largely around the provision of acute care versus the provision of mental health services in the community as funded by Medicare, and that makes integration of these services particularly difficult. So by estimates, there's about $9 billion a year spent on mental health in Australia as a whole. That's all spending in Australia, and most of that comes through the government. Private health insurers pay. If you've ever looked at your private health insurance policy in terms of what it covers for mental health, you'll be totally shocked, because it doesn't cover very much at all, and many of policies have specific exclusions. About $4.5 billion comes from the feds and about an equal amount from the states. The state money mostly goes nowadays to the provision of acute care. The states provide much less in the way of community-based services than they used to. And the federal money goes primarily through care funded under Medicare, mostly for psychiatry, even though in the maldistribution of psychiatrists is absolutely appalling. Outside of the leafy suburbs of Sydney and Melbourne, there are very few psychiatrists in Australia. It's quite problematic. Of course, not everybody needs to see a psychiatrist. Many people will do very well seeing a psychologist, an occupational therapist, a social worker, a mental health nurse, a range of other trained health professionals. But the ability to get that paid for by Medicare is extremely limited. Most of it is paid for under a program called Better Access, which is coordinated by GPs. Better Access has certainly improved access to mental health services, but it's primarily improved it for the people who are less ill. Mostly well-to-do women living in metropolitan areas get the most services. So there's a dread. The Royal Flying Doctor Service recently described mental health services in regional and remote areas as in crisis, and that's the case primarily because there are just no mental health professionals in that area. The Royal Flying Doctor Service itself does provide some money, and there's some new money, $20 million in the budget, to enable them to do more outreach. But if you divide $20 million sounds like a lot, and it's certainly, one shouldn't look a gift horse in the mouth, but remember that's over the forward estimate. So if you divide $20 million by 4, that's $5 million a year, and you think about what the need is, and suddenly it starts to look really sad and really pathetic. In this year's budget, the Minister for Health, Greg Hunt, has said that because of his own family experiences, he is very passionate and very engaged in mental health. And certainly been the case. The problem is that I think perhaps because he doesn't sit where funding decisions are made, the funding that he's been able to provide has been very ad hoc and not in accordance with either the 5th Mental Health Strategy or any other discernible long-term vision. It's been, I'm visiting here, I've got an announcement, and off you go. The most important provision, I think, that is in this year's budget is funding of some $100 million that's directed specifically at older Australians. The mental health status of older Australians is often ignored, in part because it's often hard to separate dementias and problems that are caused by polypharmacy, mental health confusions caused by polypharmacy with mental health problems, mental health disorders. And we need to remember that there's a very strong correlation between chronic disease and mental health. We kind of understand that for cancer. We know that cancer messes with your head, and we actually do something about it in terms of provision of psychosocial services. But we don't understand that if you have a heart attack, that messes with your head as well. And people who have arthritis, who have asthma, are often severely depressed because their lifestyle and their quality of life is truly inhibited. So there's a very real correlation, what we call a comorbidity, between chronic disease and mental health. People like George Rubin, whom some of you would know, have done work showing how much more that costs our healthcare system, and obviously how much more that interferes with people's quality of life. So that's a long-winded way of saying why older Australians do have mental health problems, and to date they've not been properly looked at. So $80 million over the forward estimates over 4 years will go to providing mental health services for residents of aged care facilities. We don't have any detail about how that will be done. We don't even know if there are enough psychiatrists and psychologists willing to do that. Remember, we know that GPs are very reluctant to provide services in aged care. We don't know if it will be funded through block grants or if it will be funded through Medicare. That remains to be seen. Nevertheless, I think we have to be optimistic that this is a beginning. And I think we must push for good evaluations, and if the evaluations show this is working, then we must push for it to go on. There's also $20 million, again over 4 years, for provision of mental health services in the community to be provided by mental health nurses for people aged 75 and over who are living in the community, who are at risk of loneliness because they're isolated, because they're socially isolated. If you think about it, there's a lot you could do to help those people. Just having someone come and visit them on a regular basis would be very helpful. So again, I'm sort of skeptical because it's so little to do so much with. On the other hand, I'm sort of optimistic because at least for the first time we're getting started on that. So I have done an analysis that will come out today, I think, a big volume of Women's Lens on the Budget that's produced by the National Foundation of Australian Women. And I've done 2 bits in that, one on mental health, Women's Lens on mental health, and one on what the budget means for Indigenous women. And I've rejigged the mental health bit, so I've actually got a handout of specifically what the budget means, which if you would like, come see me right now and I'm really happy to give you a copy, or I can send you a copy on email. So why don't I stop talking, because we've got lots more interesting things to see and do and talk about. And if you've got any questions, perhaps I can answer them either now or on the way.
I'm interested in funding for vets and next vets.
Yes. It's not great, and I can't give you the details of it because it's funded, most of that is funded through Veterans Affairs. I do sort of pay attention to that. Obviously, they've got much better about community recognition of the difficulties that people face reintegrating back into society after they've been overseas with post-traumatic stress disorder and so on. I think in every case, mental health services come nowhere near meeting the need. A lot of people aren't willing to come forward to say they've got a mental health problem. There's still a certain amount of discrimination. Workforce is a real problem. There's an estimate that probably only about 1 in 3 people are getting any sort of treatment, and only a fraction of people who are getting any sort of treatment are getting treatment that matches what evidence would say is best practice. So that's not a particularly good answer to your question. I can do some more homework for you and find something specific if you'd like.
What, in your opinion, does the budget do in terms of its effect on the ability of community-managed organisations to provide that important middle layer of support services for people in the community? Every time we see a budget or any discussion about funding, that layer seems to be missing, and of course that's the layer that we're advocating for here at Callan Park.
The question was, what does the budget do for those community-based organisations who are so important in providing help and support? There is funding in the budget for, off the top of my head, for 3 community-based organisations. Life gets additional funding of $33 million. Lifeline currently gets about $19 million a year from the feds, and that will give them an extra $6 million a year. So that's kind of important. There's some money for SANE, for a suicide outreach program, that they're a sort of a public education, public awareness program that they're doing. And there's some money for Beyondblue. This actually also important. Thank you for reminding me to talk about this. For a program that they have recently trialled and evaluated. It's called Wayback Support Services, and it's about providing support to people who have attempted suicide as they exit hospital. So often those people they get their treatment in the acute care sector, and then it's time for them to leave generally after only a few days, and they may or may not have access to support services in the community, and yet someone who has attempted suicide is at greatest risk of dying at suicide in the future. The problem with that particular funding, it's $30-something million over 4 years, of which $10 million will go to Beyondblue to coordinate the services, and the remaining money is to go to the primary health networks to commission those services. So that's about $20-something million to the PHNs to commission those services, but that funding is contingent upon the states and the territories providing matching funding. So if the states and territories don't provide matching funding, presumably there is no money, and whilst the Western Sydney PHN and the Central Sydney PHN are going to have a pretty easy time, a relatively easy time commissioning those sorts of services, the PHN that covers most of outback Western Australia, I think, is going to find it really hard. Okay, why don't
should we see if anyone would like to make any comments in the circle? Just on, does it go around? Any comments or questions in relation to that? Anyone like to add anything, Ellie?
Well, I want to add, look, I guess I've just been thinking about community mental health stuff, and also there was a really great article in the Monthly about mental health support in prisons and the number of people in our ever-growing prison population. And I'm sort of wondering what's next, Lesley, for mental health support and treatment in prisons, given that the unmet need and demand is just extraordinary in New South Wales.
And let's not forget that some of the budget measures are actually likely to increase incarceration by making it a lot more difficult.
Great work, guys.
Oh, look, it's appalling. I've been focusing on incarceration rates for Indigenous Australians, and there are strong links. I heard some figures just this past week. Young Indigenous people who are incarcerated are supposed to have a hearing test. Only about 3% of those people get a hearing test, but 98% of that 3% that were tested are found to have hearing problems. Small wonder then that they don't learn and they have behavioural problems that ultimately see them ending up in prison for relatively small infractions. The problem is that prison health is funded by the states, Different states have different mechanisms for doing that, and they also have a different scope of services. So I think if we're really serious about rehabilitation of people who are incarcerated, particularly our Indigenous people, then I think we really need to be pushing to do something more. Yes, it's a very serious problem.
Gideon, would you like to comment at all, since we know that you're in the midst of writing the Gavin Mooney Memorial Essay Competition on related topics?
Yeah, well, I thought particularly in terms of the hearing tests, that's a very interesting topic. I've heard quite a bit about Indigenous men who are imprisoned and have issues with hearing, and sometimes the services provided to them, not just at the point of entry into prison, but even further along, can be extremely problematic. So accessing specialist services, there are people who are who are perfect candidates for things like cochlear implants, who just can't access them. And in one particular story that I've heard is a man who was deaf, in fact, and couldn't access his specialist appointment because he couldn't hear the announcement over the prison loudspeaker. And it's kind of emblematic of the way that services are run in prisons, particularly, where there's a huge disconnect between what people, between the simple and basic kind of care that people really need, and the complexities of providing that in a prison environment. And sometimes that can be as simple as having someone there to get them to their appointment in a prison, someone helping, and sometimes it can be as difficult as how to manage someone who's at serious risk of multiple comorbidities when they need to go see specialists for their complex appointments. And I think that's a huge disconnect that's completely missing in most of our policy at the moment, and it's a bit of a tragedy.
Thanks, Gideon. I'd just like to do a shout out to our Croakey colleague, Dr. Megan Williams, who sent her apologies for this morning's walk. And in fact, the reason she's not here is that she's tied up with her volunteering work visiting people in prisons. So, just like to acknowledge a lot of really good work does go on the ground, happen on the ground by people connected to communities. Does anybody else want to comment? Gabby, did you want to comment at all?
Shall we walk on up the
we can
hill,
walk and
because
talk.
we're supposed, yes,
Running out of time, we can walk and talk.
Oh, no, I was just interested in what's happening with the multicultural communities.
Yep.
Because in southwestern Sydney, it's such a diverse community, and there's a lot of new arrivals, people with war trauma. So I'm interested in that. I know there was a budget announcement, but I don't know much of the details. And also the usual prevention. Yes. And where's the health in all policies? It's like before things get really bad, where's the money, things that can be done outside of acute services.
Yeah, and also, just in the budget, we do see a lot of measures that are going to make life more difficult for people who are already doing it.
Absolutely.
Tough. So, the role of the state in contributing to mental
pushing people over the line.
Stress.
Yeah.
Absolutely. Okay, well, thank you very much.